Support for the Leadoff on WGLT and WGLT.org comes from the Central Illinois Regional Airport, where family trips to Florida can begin and end close to home. Nonstop service on Allegiant Airlines to Tampa St. Pete and Orlando Sanford from Bloomington. Close, convenient, Sierra. More at CIRA.com.
A Bloomington-Normal group is seeking public input as it looks for ways to reduce barriers to recovery services. It's one of the things you need to know to start your day for Friday, November 21st. I'm Ryan Denham, and this is WGLT's The Leadoff. Now let's lead off with McLean County's new Behavioral Health Action Plan, which has targeted recommendations for reducing interactions with the criminal justice system. WGLT's Lauren Warnicki has more.
A McLean County judge says the mental health treatment program she's piloting could be used to support criminal defendants in need of care. Rebecca Foley runs the Assisted Outpatient Program, which creates an accountability structure for people in need of court-ordered psychiatric support.
If this is successful at this level, can we replicate this model perhaps for people who are charged with a criminal misdemeanor, who are known to have a behavioral health history, who might need treatment?
Participation in the voluntary program could lead to those charges being dropped. The idea is one of the 14 criminal justice recommendations on McLean County's new Behavioral Health Action Plan. The plan lays out goals through 2028. It's created by the Independent Behavioral Health Coordinating Council, which Foley chairs. Another goal is finishing an update to county-wide record keeping. A new system being rolled out gradually umbrellas records for police, courts, the state's attorney and public defender, and the jail under one system. Foley says a long-term goal is to add health data, such as medications and hospitalizations, to a shared record management system.
If, for example, there's someone who has a mental health diagnosis, what that is, and that way if law enforcement knows that when they're responding, they'll know how to properly deal with that.
Approximately half of the jail population is reported to have a mental health issue. Mental health conditions are primarily tracked by law enforcement and jail staff through observable symptoms. For The Leadoff, I'm Lauren Warnicki.
Here are some other stories we're following in the WGLT newsroom. Illinois public health officials are criticizing changes to the CDC's website that make unfounded claims regarding vaccines and autism. Illinois officials say the science is clear that vaccines are safe, effective, and save lives. Unit 5 expects to save millions of dollars through an agreement with the Illinois Shines Community Solar Project. Solar company Sun Central plans to provide electricity to the district from a planned solar farm. And renovation work has nearly finished on the Village of McLean's old water tower. A nonprofit bought it from the village, 20 miles southwest of Bloomington-Normal, to help turn it into a tourist attraction. It's right along Route 66. You can find more on these stories at WGLT.org. A community group in Bloomington-Normal is seeking public input as it looks for ways to reduce barriers to recovery services for people battling both substance abuse and mental health disorders. Kat Hayes is the lead coordinator for the McLean County Recovery-Oriented System of Care, or ROSC, which is running an online survey. In this edition of WGLT's Sound Health, she tells WGLT's Eric Stock they want to see how public feedback lines up with what respondents told them last year.
We're looking at not just for people who are in recovery, but also people who are seeking to initiate recovery. We're wanting to figure out where we can best support our community members and neighbors.
And how do you go about doing that? What types of questions are you asking?
So we're repeating our questions that we did last year. I want to say without the demographics information, it's about like 17 questions. Things we're looking at assessing whether people agree or disagree if there's a stigma around substance use and co-occurring mental health disorders. Looking at how easy is it to access different services within McLean County, such as initiating medication-assisted recovery or accessing harm reduction resources. Also looking at how can we best ensure effective service delivery. And again, that's looking at how accessible are our services within McLean County.
And when asking whether there was a stigma around mental health or substance abuse, what are you looking to gain from that?
One of the big things that is a barrier for people to really initiate treatment, whether it is for a substance use disorder or a mental health disorder, is stigma. Stigma is preventing people from seeking that care for fear of being judged and other repercussions. And with it, it's keeping people from, having better health outcomes and quality of life. And ultimately, for me, reducing stigma is, we're not just like it's a nice thing. It is, we're trying to save lives for people who are either dealing with possibly overdosing or are feeling suicidal. So this is like the bottom line is lives saved from stigma reduction.
Since the questions were same as last year, did respondents tell you that there is a stigma that is preventing treatment?
Most definitely. We're still seeing stigma related to substance use. One of our early insights actually is about 1 in 4 survey respondents disagree that residents of McLean County are able to access mental health or substance use treatment regardless of factors like race, ethnicity, income level, sexual orientation. So we are still seeing a lot of pervasive stigma around accessing help, whether it's if you face discrimination or if it's, you are facing fear of judgment for having a substance use issue or mental health issue.
So if this stigma exists and these barriers exist, how do you then go about removing them?
A big part of it is education. It's already been this fiscal year, which started July 1st. We've had 3 trainings. We partnered with Sergeant Mike Gardner from the ISU Police on addressing social and emotional intelligence. We had an Addiction 101 training at our right before our in-person September council meeting. And last week, we partnered with a local human trafficking nonprofit here, Allies Against Trafficking, along with an educator from down at SIU School of Medicine for addressing what does it look like to support drug-endangered children.
That was Kat Hayes from the McLean County Recovery-Oriented System of Care speaking with WGLT's Eric Stock. Those community surveys are due back November 30th.
Support for WGLT health coverage comes from Carle Health. You can count on Carle as your partner in healthcare. Information at carle.org.
And that is it for today. I'm Ryan Denham. The show was produced by Cheyenne Brown. You can subscribe to the Leadoff on the NPR app or wherever you get your podcasts.